couple minutes.
Good morning, everybody. I want to welcome Governor Ron DeSantis, Lieutenant Governor Jeanette Nunez, and Secretary Mary Mayhew of the Agency for Healthcare Administration. I have to say that, Governor, thank you for your leadership on this very important issue, and I'm really appreciative of everything you've done for the people of the state of Florida and also for us here in Miami-Dade County. These are difficult times, and I can't say enough about the governor's leadership and his administration's close collaboration with Miami-Dade County to protect our residents from COVID-19. Thank you again, Governor DeSantis. Now the governor will speak about the next steps before we turn to other speakers, and then we will have questions. And again, Governor of the state of Florida, Ron DeSantis.
All right. Thanks, Mayor. Appreciate it. Well, good morning or afternoon. Thank you for coming. Last night, the Florida Department of Health announced 6 new cases of COVID-19 in Florida, including the first reported case here in Miami-Dade County. That was a 56-year-old male who had recently traveled internationally, in this case to Iran. We now have 34 Florida cases, 31 Florida residents, 3 non-residents, 26 were diagnosed in Florida, 5 Florida residents were diagnosed and isolated in another state. 3 non-Florida residents have been diagnosed and isolated in Florida. We have had 2 fatalities due to COVID-19 thus far. 14 Florida counties now have a patient who's tested positive. The total number for Florida Department Health figures, we have 151 tests currently pending results. 392 tests have come back negative. 963 people have been fully monitored to date, and 324 are currently being monitored by the county health departments. So our approach for my administration to combat the spread of COVID-19 in Florida has 5 primary areas of focus. The first is to protect the vulnerable. We have a virus, and this is a new virus. People are learning more about it every day, but the data is overwhelming that for those who are elderly or have serious underlying medical conditions, this is a virus that could be much more significant for you than for people who may be in younger age groups or have a healthier profile. And so this is a population that we certainly want to work hard to protect. This morning, Mayor Jimenez directed the temporary closure of certain senior facilities and daycares, and I applaud him for his decisiveness. I think that was the right thing to do. Yesterday, I directed the Florida Department of Emergency Management to temporarily prohibit individuals who have risk of carrying COVID-19 from visiting nursing homes, assisted living facilities, adult family care homes, long-term facilities, and adult group homes. I mean, this is a time to be restricting access to facilities that house those who are most vulnerable to COVID-19. The cases in Florida have and will continue to disproportionately affect our elderly population, including those with underlying conditions. The two fatalities both were elderly, but both had underlying medical conditions. If you look at the profiles of the folks who have tested positive in Florida, it's been overwhelmingly people who are in their 50s, 60s, 70s. Now, I think part of that is because some of the younger folks don't necessarily develop as serious symptoms, and they may not present to be able to have. But we also know that the hospitalization is overwhelmingly with those who are elderly and frail. Second thing we have to do is increase our testing capabilities in the state of Florida. We had initially been thinking we were going to be in receipt of tests from Health and Human Services. Obviously, that test proved problematic, so they had to reissue those. But I've directed Director Jared Moskowitz with our Emergency Operations Center to purchase 2,500 commercially available testing kits. So we're receiving those this weekend, and the testing kits will give qualified labs throughout the state the process or the capacity to process tests for up to 625,000 individuals. I directed our Surgeon General, Dr. Scott Rivkees, to strategically distribute these testing kits to 50 CLIA-certified labs throughout the state, starting with hospitals so that testing can be completed closer to the patient. And Jackson Memorial will be one of the first hospitals to receive the kits. There's a concern when people present in a hospital, if you send it to the health department, that could take 24 to 48 hours. The CDC takes 3 to 5 days. The private capacity, which potentially is going to be robust, is not going to be as quick a turnaround. And so if they're able to do that in their own labs in the hospitals, the turnaround time can be quicker, and they will be able to make better use of their resources here in these healthcare facilities. Now, there's an important qualification. These kits are kits that do not include sample collection and swab materials. So they perform the testing of the sample. Now, we wanted to, at the Department of Emergency Management, also purchase swab materials and sample collection materials. There's a nationwide shortage of that right now. Now, many of the labs throughout the state do have some supply of these, but our capacity to reach the total amount that our testing kits will allow is really dependent on how much of the materials are available or can be brought into the state where you can actually extract the sample. And so we're working with the different facilities around to see what that capacity is. And then as soon as there's an ability to procure more of that, we have a standing order with the Department of Emergency Management to go ahead and procure that. In the meantime, though, these testing kits will help many hospitals and labs that do have the swabs on hand. And so I know that speaking with the leadership here, that's something that will make a difference for them. The third thing we need to do is increase social distancing measures. Yesterday, I directed Corrections Secretary Inch to suspend visitation at state prisons for 30 days. Inmates will continue to have access to mail, phone calls, and video visitation, and legal visits will not be impacted. Today, I'm suspending all official travel for state employees. The suspension will initially be for 30 days. I also am directing state agencies to maximize remote working and telecommuting. The state has a workforce of over 90,000 individuals whose health and well-being are a priority. And if they can perform functions at home, now's a good time to do that. Further, based on the recommendations of our health officials here in the state of Florida, I am recommending to local municipalities and private entities to strongly consider limiting or postponing mass gatherings in the state of Florida. I was in contact already today with the commissioner of the PGA Tour, commissioner of Major League Baseball. This is an opportunity, our health officials believe, where some of these large-scale events, can be postponed and do it later. Some of the athletic contests, I recommended to the PGA, if they're not allowing the fans in, they can still compete the event and put it on television. People are going to be isolated or social distancing at home. That will be helpful. But if a mass gathering is not canceled, and I don't have the authority as governor to order all mass gatherings canceled, but if it's not, you need to have organized screening measures in place. I mean, for example, before entering, an attendee should be asked if they are sick or if they've been in contact, not only from some of these foreign countries that have seen outbreaks, but places here in the state of Florida, such as the cruise ship terminals. The fourth area of focus is protecting our healthcare workers. This is something we discussed with the folks here at Jackson today. Our Department of Health and our Agency for Healthcare Administration are working overtime to ensure all medical providers are following appropriate protocols when dealing with individuals who have or may have COVID-19. We want to keep our healthcare workers safe. And we want them to be in the game. If we have somebody who is exposed and then they're doing their job and interacting with other people, you self-isolate a half a dozen, 20 healthcare workers. That makes it much more difficult for the folks here to do their jobs. The Department of Emergency Management in Florida has secured contracts for nurses to be brought in the case there's personnel shortage. And I've also directed Director Moskowitz to purchase additional personal protective equipment or PPE. Finally, we must continue to monitor international and high-risk travel. Here in Florida, we'll continue to closely monitor travel and message as effectively as we can when we find out new information. So most recently, we had initially someone in Santa Rosa County who had tested positive. The international travel involved going on a cruise on the Nile River. And so that was something that was noted, but there wasn't any type of overriding guidance about that part of the world. Then we had another individual test positive for that. Our health officials talked with the CDC, and they noticed that there were some people throughout the country who had also been on there. So the Florida Department of Health put out an advisory, and a number of people in Florida and beyond who were on Nile River cruises recently presented with symptoms. And so now, of all of Florida's cases, 10 of those cases are connected to the Nile River. So that's over 33% of the cases in the state of Florida. So it's important that we remain vigilant here in the state of Florida. I think taking proactive measures will help us flatten the curve of this. As people get exposed, there's a lag in terms of when they present symptoms. And so we're obviously conscious about the individuals who may be impacted by this directly. We also understand that if more and more people get infected this without changes in behavior or other types of changes in policy, that's going to put an enormous amount of stress on our healthcare system. And a lot of the other ailments are not going away. People are going to need medical care in a variety of different contexts unrelated to this virus. So please continue to visit the Florida Department of Health's website for the most up-to-date information and guidance, floridahealth.gov. I want to thank the mayor. I want to thank Carlos Magoya. I want to thank our Lieutenant Governor for their work and Secretary Mayhew. We'll hear from a few other folks here, and then we'll all be happy to take some questions. So I'll introduce right now our Lieutenant Governor.
Good afternoon. Thank you, Governor, again, for your leadership on this very important issue that our state is facing. Thank you, Mayor, the rest of the elected officials that are here with us, our Secretary, Agency for Healthcare Administration. I'm going to share what the Governor just said in Spanish. Buenos días, muchas gracias por estar aquí con nosotros. Anoche el Departamento de Salud anunció 6 casos adicionales de COVID-19 aquí en la Florida, incluyendo el primer caso aquí en el condado de Miami-Dade. Un hombre de básicamente 56 años con un reciente viaje internacional. Ahora tenemos un total de 34 casos en la Florida, 31 residentes de la Florida, 3 no residentes de la Florida. De esos 34, 26 están diagnosticados aquí en la Florida, 5 residentes que están aislados en otros estados, no aquí en la Florida. 3 residentes que no son de la Florida, pero están diagnosticados aquí y aislados en la Florida. Y lamentablemente 2 fallecidos. 14 condados en el estado de la Florida en este momento tienen un paciente que ha resultado positivo. Nuestros totales de pruebas siguen siendo lo siguiente: 151 pruebas que están pendientes los resultados. Más de 390 pruebas han dado negativo. Hemos monitoreado un total de 963 personas en sus casas y hoy día estamos monitoreando un total de 324 que siguen bajo monitoreamiento del Departamento de Salud. La estrategia de nuestra administración para combatir el COVID-19 tiene 5 áreas principales de enfoque. El primero es proteger a nuestros vulnerables. Esta mañana sabemos que el alcalde Jiménez dirigió el cierre temporal de ciertos asilos de ancianos y le agradecemos su decisión. Ayer el gobernador dirigió a nuestro director de manejo de emergencias, el director Moskowitz, que ha prohibido temporalmente que personas de alto riesgo visiten a nuestros hogares de ancianos, centros de vida asistida, hogares de cuidado familiar para adultos, centros de cuidados a largo plazo y hogares grupales para adultos. Cualquier persona infectada con COVID-19 que no haya tenido 2 resultados negativos consecutivos separados por 24 horas está prohibido visitar estos centros. Cualquier persona que muestre o presente signos o síntomas de una infección respiratoria está prohibido visitar. Cualquier persona que tenga o puede haber estado en contacto cercano con una persona infectada con COVID-19, también prohibido visitar durante 14 días desde su interacción con la persona infectada. Cualquier persona que ha viajado internacionalmente es prohibido visitar durante 14 días desde su regreso a los Estados Unidos. Cualquier persona que viaje en un crucero, prohibido visitar durante 14 días desde su regreso. Cualquier persona que haya estado en una comunidad con difusión comunitaria confirmada es prohibido visitar durante 14 días después de salir de esa comunidad. Y finalmente, cualquier persona que reside en una comunidad con contagio comunitario confirmada es prohibido visitar estos centros de ancianos. De nuevo, el gobernador reiteró que estamos muy preocupados con las personas de tercera edad. Es la persona más vulnerable y queremos tomar todas las medidas importantes para proteger esas personas de tercera edad. Los casos en la Florida han afectado y continuarán afectando desproporcionadamente a nuestros ancianos y por eso estamos tomando estas medidas, particularmente aquellos que tienen aflicciones médicas subyacentes. Esta orden fue necesaria e instamos al público a que tenga en cuenta a esta población mientras continuamos respondiendo al COVID-19. Segundo, debimos aumentar nuestra capacidad de pruebas y por eso nuestra administración le indicó al Director Moskowitz que compre 2.500 kits de prueba disponibles en el mercado que recibiremos este fin de semana. Los kits